Today we will be exploring depression in elderly populations. We will be analysing different assessments, treatments and nurse interventions for depression in adults over the age of 65. Comparisons will be drawn between delirium, depression and dementia. We will also investigate the effects of depression on the individual, the family and the community. Psychiatry differs from many other fields of medicine in a way that there remains to be little to no conclusive diagnostic tests for psychiatric illnesses. When assessing a client with depression, a mental state examination is the tool of choice in most healthcare settings. A mental state examination is a subjective screening tool that observes a range of behaviours and psychological features of a client in order to ascertain a comprehensive insight into their current mental state. When used in collaboration with other assessment tools, including personal, medical and family history, and presenting complaint, a clinician is able to formulate a diagnosis, identify any immediate or notable risk, and individualise a care plan for the client. There is a range of inpatient and outpatient treatment options for elderly clients with depression. Pharmacotherapy is a common treatment of depression. Antidepressant medications come in a range of different subcategories. The decision as to which antidepressant is most appropriate is made by the psychiatrist in collaboration with the client, taking in consideration the whole client situation, including severity, range and duration of symptoms, comorbidities, allergies and drug sensitivities. Side effects of antidepressants range between drug types, but commonly include insomnia, headaches, nausea or sexual dysfunction. Depression can also be treated with psychotherapy. There are a range of different psychotherapies that can be effective in treating depression in the elderly. Whilst the specifics of each therapy varies, they aim to equip the client with skills to understand, process and manage their emotions. Electroconvulsive therapy, or ECT, is a more invasive treatment for depression, used in more severe cases. ECT involves passing a controlled electrical current through the brain in order to stimulate a generalized seizure. The client is given both a short-acting general anesthetic and a muscle relaxant prior to ECT. Clients receiving ECT require close monitoring after treatment. The main side effect to ECT is memory loss of events immediately before and after the treatment, headaches, nausea, confusion, and low blood pressure. Transcranial magnetic stimulation, or TMS, is a relatively new psychiatric treatment for depression. TMS is recommended for clients with persistent major depression that has not improved through pharmacotherapy. TMS involves using magnetic fields to stimulate particular parts of the brain. It is non-invasive, requires no downtime, and does not require anesthesia. When a client is admitted to hospital for mental health treatment, there are a number of roles for the nurse to ensure adequate treatment, safety, and care of the client. One-to-one support between the nurse and the client gives the client a platform to share their experiences and feelings each shift. It allows the nurse to maintain an up-to-date mental state examination and risk assessment. The nurse is also responsible for encouraging medication compliance and monitors the client for adverse effects or side effects of medications and treatments. The nurse collaborates within the multidisciplinary team to achieve patient-centered care, which includes working with psychiatrists, psychologists, allied health, and the client to achieve an individualized care plan to support recovery. Dementia and delirium are two separate conditions that share many of the same symptoms. Dementia is a term used to describe a range of disorders of the brain that cause the ongoing decline of an individual's cognitive function, causing memory loss in particular. Although there is no treatment for dementia, medications can be used to reduce the severity of symptoms. Delirium is not so much a condition, but rather a result of pre-existing medical conditions, changes in medication, or other factors. It can cause an abrupt change to an individual's memory, thought, attention, and speech. Dementia usually starts as minor symptoms, often not having much of an impact on the individual. Over months or years, the condition will progressively worsen, and that is when symptoms begin to become more and more debilitating. Delirium usually has a sudden onset, with the symptoms often shifting in severity throughout the course of the illness. Depression can have a huge impact on the life of not only the individual, but also their family and the wider community. Depression is the leading factor contributing to emotional suffering in the elderly and can further cause problems with an individual's physical health and social involvement. Elderly people with depression can withdraw from social activities that they once enjoyed, contributing to feelings of loneliness and isolation. This lack of motivation for daily activities can also result in neglect of self-care through diet, hygiene, and medications, which can negatively impact the individual's physical health. It is also known that the family of older adults with depression are negatively impacted by the illness. Often little attention is directed towards the family of the mentally unwell individual, as the focus is on caring for the individual with depression. Caregivers may also be heavily impacted by the emotional burden of witnessing their family member in such a depressed and potentially suicidal state. The family may be impacted by financial costs regarding treatments and medications, and the cost of aged care if they are unable to provide the care that the elderly family member needs. Depression in the elderly also has a significant impact on the community. As depression can drastically reduce an individual's motivation for daily tasks, they may feel unable to attend their job. An individual with depression may also require numerous primary healthcare visits to either general practitioners or hospitals. This puts pressure on the medical system, increasing costs regarding support services and treatment for elderly patients with depression. We hope you have found this presentation informative. Thank you and have a great day.